The background of this is that I did create a graduate level medical school curriculum on SIBO between 6 and 8 hours long, depends on how I give it each year. So that is what I'm bringing to this course, that material, but more. It's a comprehensive training course.
I think structural issues can go overlooked at times. There truly can be physical, anatomical things amiss.
But to me, the best mode of teaching is, it's really about organizing the material. But synthesize, of course you have to have a broad understanding and synthesize it, but organizing it, like you say, step by step, this comes here, and just making it simple to apply. So the other thing I really like to do is focus on clinical. That's my whole emphasis. I don't really spend a whole lot of time just showing you things or talking about things that are just academic for their very nature. I only bring those things up as they specifically relate to something you're going to need to know.
So the treatment goals in the green boxes here, it's either 90% symptomatic relief or a negative breath test.
So that you really understand it. And I've spent a lot of time, talking about like checklists for the physician, at the end of this appointment, what do you do in which appointment? And what did you need to make sure you communicated to the patient? I've got a patient communication checklist and things like that. Really very, very clinically applicable. For the clinicians who take this class, I want to teach them how to think about this condition. Because if you have that, then the protocol itself doesn't matter. You'll be able to adapt whatever you need to and whatever you have in front of you to help in the circumstance of SIBO. And that's what we all want. That's what doctor training should be. A lot of people are missing some of what I would call the basics, kind of like standard of care pieces and understanding.
I'm going to go through them, and then I'm going to show you my guidelines.
And many people aren't even familiar with the algorithm that we have, and just a lot of the organizational, structural basics for SIBO. But to your point, it's chronic. SIBO is chronic for the majority of people who have it. 2/3 are what the studies show. So when you have a chronic condition, you need to understand long-term management and really how it fits into all the other diseases that cause it and that it coexists with. Any amount that you learn on SIBO that is well structured will really help the doctor for so many of their patients, because it's so common, these digestive complaints, and especially when they have chronic disease. SIBO is so common in other chronic diseases, and you need to know how to manage it more than anything, because it directly affects people's eating, because the symptoms of SIBO come from eating, and the whole category of carbohydrates, which is most of our exceedingly healthy foods like fruits and vegetables, become problematic, and people can get into a circumstance where they have trouble eating, and everything they eat makes them sick. So it's just, this is the relevance of why it's so important to learn about SIBO.
It goes down into the large intestine where we normally have our bacteria.
Even if the person has other chronic disease or other complicated circumstances, through that, we need to be able to manage the SIBO appropriately and well so that they can eat.